Hi there, I'm Dr. Shauna Daru, and thanks for joining me for today's video. I'm going to be talking about thyroid, and this is something that I see in my practice every day. So people may be on a thyroid medication, be diagnosed with hypothyroidism, and still not feel well. So bottom line is, if your thyroid is being treated properly, you should feel better. So being on Synthroid or even desiccated thyroid, if it's done properly and your health is supported, then all of those annoying thyroid symptoms should go away. So first of all, a little introduction. I am a naturopathic doctor and I have a busy clinical practice in downtown Toronto. I've been doing this for at least 14 years now, and with a focus on women's health and hormones. So treating hormones is something I do every day. And this series of short videos is just to teach you a bit more about how your hormonal systems work, to give you some clues and ideas to be diagnosed and treated better, and most importantly, to feel a whole lot healthier. So thyroid. So your thyroid is the butterfly-shaped organ that is in your throat, and it controls your metabolism. And your metabolism is, your weight. It affects your mood, it affects your brain, it affects your digestion, your cardiovascular system. It's really profound how it can impact your life. So when people are on medication for their thyroid, I'm going to be speaking about hypothyroidism, meaning underactive thyroid. They're taking it because at some point you were diagnosed with an underactive thyroid. What's often missing is a full diagnostic picture, meaning understanding why is the thyroid out of balance and why do you need medication. Thyroid issues are enormously on the rise right now, and in most cases it's an autoimmune condition called Hashimoto's thyroiditis. And autoimmune means that your immune system is attacking the thyroid, causing it to function inappropriately. Symptoms of low thyroid are things like weight gain and difficulty losing weight, feeling tired all the time, getting cold and chills that are hard to warm up from, depression or apathy, dry skin, dry hair, hair thinning. Thinning at the lateral side of the eyebrows is a strange one, but associated with low thyroid. Getting sick more frequently, so more colds and flus, constipation, difficulty concentrating, and even body aches and pains. So there's a vast array of symptoms. Most people don't have all of them. They might just have 2 or 3. And if you have a couple of these symptoms and you're being treated for your thyroid, I would suggest that we need to figure out, why are you not feeling 100% better? So there's a few reasons why you would not feel well on thyroid medication for hypothyroidism. Number one is that your dose might be too low. The lab testing for thyroid function has a reference range that does not necessarily mean that you are getting your levels optimal. So for example, TSH is generally the lab measurement, so thyroid stimulating hormone, that we use to determine how much thyroid medication somebody would need or how well their thyroid is functioning. On the reference range on lab tests, it depends on which lab you use, but typical range says, the reference range where you should fall is between around 0.5 and 5. Again, it might be within a small range from there, but that's not necessarily optimal. And for example, for fertility, the optimal range of thyroid function of the TSH is between 1 and 2.5. And when the level goes above 2.5, it's associated with difficulty getting pregnant and miscarriage. So if that's going to affect your fertility, I would say that that's affecting your overall body function as well. So when you're on thyroid medication, we want to be dosing it so your TSH is within, about a 0.8 to a 2.5 range. If it's higher than that, then it means that your thyroid is still underactive and you may still be expressing thyroid symptoms. So that might require a slight tweak in your thyroid medication, which is something you could speak to your prescribing doctor about. The second reason for not feeling well on thyroid medication or your thyroid symptoms not going away is that you might not be converting very well from T4, which is what your thyroid produces and what is replaced by Synthroid or L-Troxin with your medication, to T3, which is the active form of your thyroid hormone. So if your T4 and your TSH are within normal ranges or optimal ranges, we also would want to test your T3 levels. Most medications, unless it's desiccated thyroid or something called cytomel, do not contain T3, so your body needs to convert it itself. Some people don't convert very well. And the poor conversion can be because of a lack of certain nutrients, so magnesium, selenium, zinc, iodine. It could be because your body is very stressed. And when I say stressed, I mean it could be mental emotional stress, it could be work stress, it could also be pain and inflammation, it could be under-eating, over-exercising, chronic illness. There's a bunch of things that can stress the body out that will cause a low conversion of T4 to T3. Remember, T3 is the active form of your thyroid hormone, so you're still going to express all of those hypothyroid symptoms, even though it looks like you're on the right dose of medication. Under-eating is another cause of that low T3 conversion, which I find a lot of women who are dieting get themselves into a scenario. And even with intermittent fasting, we have to be careful with this one. So where you're restricting the eating hours through the day, pushing that too far for your stress level and your metabolism can slow down thyroid function just as under-eating can. So looking at your conversion, testing your T3 levels, making sure that they're around mid-range in the reference range and not too low would be the next step there. The third reason that you may still have thyroid symptoms when you're being treated for hypothyroidism with medication is autoimmunity, meaning that there's still an inflammatory process going on in your body that hasn't been addressed. So as I mentioned at the beginning, the most common cause of hypothyroidism is something called Hashimoto's thyroiditis, which is an autoimmune condition where your immune system is attacking the thyroid. So if we're not addressing the autoimmunity and the inflammation, you still may have a bunch of symptoms going on, especially inflammatory symptoms like fatigue, body aches and pains, general malaise, and a low mood. So this is again quite simple to test for. There are tests for your thyroid antibodies, which are called anti-thyroglobulin and anti-thyroperoxidase antibodies. So these are just basic blood tests that you can request to see if those are outside of reference ranges. And if that's the case, then we need to work hard on lowering the inflammation. I will make another video specifically about Hashimoto's and lowering the antibodies because that's a big topic as well. And there are some really important and simple tools that you could start right away to lower the inflammation. The last reason that, the fourth reason that you may be still experiencing thyroid hormones is that your body is stressed. So again, stress refers to a lot of things going on, meaning mental emotional stress, overworking, pain and inflammation, chronic illness, lack of sleep, poor blood sugar control, all of those things. So what that means is that your body may be slowing down your thyroid function or thyroid utilization for a good reason to protect you. And women's bodies are very sensitive to this, meaning that we can overwork ourselves into thyroid dysfunction. We can over-exercise to thyroid dysfunction. We have to be careful that we're fueling our bodies properly and resting sufficiently. So that's a huge reason that you may still be experiencing thyroid symptoms and your body may not be responding optimally to your medication. And the last reason is that you may be taking your thyroid medication wrong. So with Synthroid, L-Troxin, and other standard thyroid medications, they do interfere with certain foods in terms of their absorption and utilization, as well as with caffeine. So it's really important that you take them away from food, especially foods containing calcium and iron, and especially away from coffee. And that should be at least an hour away from anything that you eat and 4 hours away from iron, calcium, multivitamins, and oral contraceptives containing estrogen. So you may be taking the right dose of medication, but not getting it into your bloodstream in the most efficient way. So all of these factors can affect how you're feeling on thyroid medication. And again, the premise being that if you are being treated for your thyroid, you should feel better. You should no longer have these symptoms, meaning your metabolism should work well. You should be able to lose weight when you eat well and you exercise. You should be able to, to get rid of the dry skin, dry hair, constipation, and fatigue that come along with hypothyroidism. This is something I work with a lot in my practice. I'm happy to answer any questions here, so please post your comments below and I will get back to you. And finally, if you enjoyed this video, please do me a huge favor and like and subscribe. I will be posting a lot more in the upcoming weeks. I have a huge mission to educate about hormones and to provide tools so that you can feel better. Thanks again for joining me and have a wonderful day.